Hi everyone, I'm going to talk to you guys a little bit about social work with the nephrology population. So nephrology deals with patients who are suffering from end-stage renal disease, and it revolves around the kidneys, so a lot of end-stage kidney failure and kidney problems. So a couple things that are unique with working with these patient population is ESRD patients. It's a chronic and lifelong illness. So the treatment for ESRD is dialysis is the most common one. There's two different types. And the best treatment would be a transplant. And even after the transplant occurs, they're still undergoing treatment to make sure that the body does not reject the organ. So there is no cure. They're constantly dealing with this disease their entire lives. It does happen to all demographics. However, it is most common among the elderly, so 65 and older. It does affect certain demographics differently. So African Americans and Native Americans, unfortunately, are not, they don't receive the correct amount of care as a Caucasian would. The severity of the illness isn't always visible. So something that's unique with these patients is on the outside it appears that they're normal and that they're healthy when they are actually severely ill. So many of them, they don't always receive the support or understanding from the people around them because they don't look sick or they don't look as sick as they are. And they kind of stay in this limbo between being healthy and being sick. Because of the intensity of the disease and how much goes into it, it does require a team effort. These patients, they require help with their diets, they require medication management, they have a transplant team, all of that. And because of the intensity of the dialysis and, constantly being in limbo or waiting for a kidney and the fact that there is no cure, a lot of them do suffer from mental health issues such as depression and anxiety. So then you have the mental health aspect of it as well, which leads to the comorbidity. Many of these patients, they do suffer from other diseases such as diabetes, hypertension, some suffer from addiction, which kind of can lead to ESRD. And as I just mentioned, depression and anxiety as well. Some challenges and needs for nephrology patients. Dietary needs is huge with these patients because the kidneys aren't processing properly. They need to really watch what they're eating in terms of potassium and sodium. They can't have as much liquid or fluid as a normal person can because their body can't filter it out. They have other life restrictions too, especially when they're on dialysis. You have dialysis a few times a week. Some, depending on the type, there's a port, so that restricts them physically in the physical actions that they can take as well. And this disease does have a high mortality rate. As I said, there is no cure. And a lot of times patients are waiting so long for a kidney, and the intensity of the treatment with dialysis and the restrictions is a little much, and many choose to end the treatment, especially when they're elderly. And it just turns into palliative care when they're waiting to die. Couple ways to address these needs. So for dietary needs, life restrictions, mortality rate, definitely advocacy and case management. Making sure that, they have access to the appropriate foods that they're allowed to have, that they have the appropriate dietitian, that the treatment team is all on the same page, that they have social supports and the correct coping skills to deal with the life restrictions and the intensity of the treatment. A lot of the restrictions that they have, they also affect the people that are closest to them, such as their families, especially dietary needs. So social supports and coping skills for not just the patient, but the entire family are very much needed. And education and support, letting them know what their medical rights are, kind of, especially when you get into the mortality of it, you can help advocate legally for them, making sure that all of their affairs are in order, that they're comfortable, that their treatment team is all on the same page. Okay, so resources. So for social workers, undertaking a patient population is always intense, especially if there's high caseloads. So you're also talking about an extremely severe illness with a high mortality rate, which can be pretty grating on social workers. So support and supervision are two resources for social workers that are very important, that they are able to, bounce ideas off of another supervisor, or to actually express their own emotions and cope with possibly grief. Because when working with patients, we all have empathy, and you do have a tendency to have attachment as well. Support for the caseloads and the workload, making sure that, you have the correct equipment that you need, the correct education and training, getting certain certifications if they need additional information on coding or billing, if that is becoming part of the job, maybe perhaps trauma, that they get that kind of education and training as well. For the patient, numerous resources are needed, so transportation for dialysis. A lot of the times, depending on where the dialysis center is and it's available, if they have transportation, that becomes an issue, especially with treatment adherence. Financial support. As I said before, a big chunk of the population for ESRD patients is the elderly, so many times they're retired and on a limited budget and only have Medicaid and Medicare and don't understand the insurance policies, and they don't understand the financial aspects of it. And then when they are younger, the demands of the treatment might make it so that they can't necessarily hold down a job. So having that financial support as a resource is tremendous. I touched a little bit about the support systems. Many studies have found that patients with a strong support system were more likely to have adherence to their treatment plan and a higher quality of life. So having those social supports is tremendous. Tremendous resource. Medication management. They're on a ton of medication, even post-transplant, for anti-rejection drugs, and counseling. It is a very, very intense disease, and it is very easy for them to develop anxiety and depression, to feel isolated. So that mental health counseling would be a very valuable resource for the patient. Distinguishing skills. So obviously micro skills are important in active listening, particularly for these patients. When it comes to this kind of treatment, when you have a treatment team, a lot of the times you're being told exactly what to do, what to eat, medication to take, what you can and cannot do, and it becomes very overwhelming. So something so simple as active listening and hearing the patient's needs, hearing their feelings, hearing what they're saying, and giving them that empathy and that safe space to really talk about how they're feeling can go a very, very long way and set you apart from others for this population. Advocacy, especially in terms of support systems. Some people don't have family, especially if they're elderly. They may be the last that's left, or the younger people in their family don't necessarily have the time to commit because they're starting families of their own. So advocating for them, maybe linking them to support groups or even advocating for a community was a great suggestion on the Week 5 post, to have volunteers from the community come in and help with this patient population, which is an excellent idea. Team collaboration, so having the effective communication skills to really be a team leader and make sure that everybody on the team is on the same page with the same goal, and really keeping that patient in the forefront of their mind. And the other thing that I think would be very unique would be trauma experience. So for a lot of people in this population, this diagnosis could be a traumatic experience. Having the kidney transplant and major surgery like that could be trauma. There's a lot of stress on family and support members, and there could be, separation there, and even the inevitable facing of death could be trauma. So having trauma experience and knowing how to help somebody through that trauma and restore their safety and normalcy is huge. You don't really think of trauma in this particular population. Most people think of, war, but people can experience trauma from a diagnosis such as ESRD2. And just a little food for thought. I'd like to know, what additional skills or certifications do you guys believe would be helpful when working with this population, and why? So postgraduate, you can get a lot of different certifications, such as trauma certification, healthcare specialization. You can specialize in cognitive behavioral therapy, even so far as maybe having a little bit of experience in medical background, like coding or billing. What do you feel would be beneficial and go that extra mile for the patient in this population? And then references, the textbook and the article that talked about the quality of life and the importance of social supports. Thanks, guys.